Welcome to this tutorial. Just want to give guidance on various aspects, especially the ones that have been displayed on the screen. Okay, so the first one is words and the studies management. Then the second one, you have a lot of notes have accumulated, so there's actually so much to study. Okay. Then on how to prepare procedures to practice, practice procedures on the words. Okay. So I fully understand to say that this is actually a very involving year and the most critical year, of course, the third year. Okay. So um, it all starts with attitude, okay, towards something. So most of the time, even in the uh, even in the presence of pressure, there are some people emerge victorious, just depending with what attitude they give to what they do. Okay. So yes, I understand to say that the words and the studies most of the time, people fail to manage to do words and the studies at the time. Okay. Because let's say you got the words um, around 07:30, then you knock off around 16 hours. Okay. You need to cook, you need to prepare again for the word tomorrow. Okay. And most of the time when you are tired, it's very hard to study actually. Okay. And if at all we might include the weekends, you'll find that weekends most of the time it's not enough to say. It's not enough for you to study because you have a lot of courses to prepare. Okay. And in case where there's some tests which you are still writing, it's kind of hard for someone to prepare effective, especially the exams and the compressed academic year. It's very hard. Okay. So how myself I manage to do words and the studies. Okay. The way it is in the in classes, we learn theory. Okay. We learn theory. Then we're going to the words. We want to apply the theory. We want to link the theory with the practical. And that's called the normal practice, actually. Okay. So the words studies management is kind of a little bit complicated, but it's not hard. So the theory that you learned in class, you just need to link it with the practicals on the words. So, for example, you learned some conditions in medicine like um, pulmonary tuberculosis, and you go to the words, you find that there are a lot of patients with pulmonary tuberculosis. Now, the problem comes in when we take words as a punishment. Words are not punishment. Words are areas where you go to learn stuffs. So when you learn pulmonary tuberculosis in class, and then you go in the hospital, you find the client with the pulmonary tuberculosis, you don't need that time to go back home so that you can go study pulmonary tuberculosis. What you can actually do is you try the very clients that are in the hospitals. So when you look at the pulmonary tuberculosis, of course the patient cannot tell you the types of the types of tuberculosis, okay? Or they cannot classify pulmonary tuberculosis, or they cannot tell you the treatment of pulmonary tuberculosis. But you just sometimes interviewing them, you are there around, you tell them what they present most of the time. You find that signs and symptoms of pulmonary tuberculosis are going to be in a much clearer picture because this patient is with you right there. You can ask them, they'll tell you I usually have night sweats. I usually cough out blood. Okay. No, sometimes I feel like not eating. Okay, I feel like not I feel like vomiting. All those are signs of tuberculosis. So you don't need to go back home so that you continue with your studies. Even whilst you are still on the wards, you can still do your studies. So there are those moments, those boring moments when you are doing nothing on the wards. You need to utilize those moments. You are with friends on the ward who knows stuff very well. Not only friends from your school, but there are a lot of people on the ward you need to mingle with. You all go there for the purpose of learning. But most of the time, we tend to use that time doing stuffs which are not even beneficial to academic. You need to understand yourself to say that you have an exam at the end of the day. Uh, the way I used to study pharmacology on the wards was when I go there, I found this patient with let's maybe I found them with the UTIs. Then I'll go on the drug chart to see what medication, according to what I learned in pharmacology, should appear there if at all they are on the treatment for UTI. And I'll find some antibiotics, including the dosage as well as frequency, including the mechanism of action. By that way, I am able to accelerate my learning because it's more like I'm doing it practically based, and like when I'm just hearing it. So on the words, you just need to make sure that you do the right thing. There are those moments when you're doing nothing. At that point, that's why it's advised as students, when you're going to the word, just carry something, a book. Okay. That book will not only help you with recording what in the hospital or maybe recording what will be taught. Sometimes you can even evaluate yourself. Try to try to write what you can remember in the previous topics that you were studying. Okay. So this is how you can try to balance words and the studies at the time. Of course, you have weekend, but the weekend is not enough. It is not enough to make you. Most of the time you spend on the words, and that is where you can only make it possible that you manage and studies with the words. So for courses like fundamentals of nursing, medicine, surgery, pharmacology, these courses can easily be learned on the words because you use them on a daily basis. So if you go to the surgical wards, you find that someone has a fracture. Start evaluating what fractures are. Okay. Look at the management of fractures and see how they are managed on the wards. What medications are they on? So if you take studies like that, you find that it will be very easy. Even if you go to study fractures, you will just be smiling like that. And like you go to the what, you do nothing, then you go back home, then you start studying fractures. That way you're just making your work hard. So when you go on the ward, your work should be much easier than when you don't go there. Because you are trying to link theory and practical. Theory and practical, they're totally different. So you need to make sure that you link them. Okay. So on the issue of there's so much to study. Of course, yes, there's so much to study. So much to study. There's a lot that you must know. But the thing is, some courses that can be studied on the word, make sure that you manage them on the word. And those courses that cannot be managed on the ward, there are some courses which you can't manage in the wards like a surgical ward, like medical wards. Those courses can be mental health. Mental health cannot be studied in the surgical or medical wards. Those ones you can be studying at the weekend. Studying with the aim of understanding. The workload is just a lot. You cannot manage to memorize unless there is no logical connection where you can remember some stuff. That's when you can memorize and just a few. Because if you start, the more you memorize the work, the more you are increasing pressure on yourself. Because you memorize today, tomorrow you forget. Then what are you doing? So you need to make sure that in as much as there's so much to study, you use different approaches, like the way I've explained some of the approaches, just to minimize on your studies. Because if you want a perfect time for studies specifically, that will never happen. I remember myself last year, I used to go in the hospital on the clinical locations with at least three plain papers. And once I go there, I'll start evaluating the topics that I want to study on that day. So if at all my on my date on my timetable there is surgery, I'll make sure that I'm going to the surgery ward and I take that as an advantage. When I go on the wards, I'll start I'll just start with fractures because I already learned the theory in the class. So I'll just write fractures and start to write what I can remember on fractures. If I write. Then depending on how much I've remembered the information, it will tell me how much I need to study. If at all I can remember most of the information, better. Then I'll just go clarify using the books. But if I don't remember most of the information, I'll just go to the patient and look at all the interventions that they have made to the fracture and asking some questions on the fracture. So, when did you sustain this fracture? This day. When were you brought to the hospital? Okay. So I've seen this. Did they explain to you the use of it? Oh yes, you find that these patients have actually more knowledge because they are always told by the doctor to say that we are doing this for each and every procedure. We explain to the patient, okay, we want to do this so that we can do this. So these people knows because they want to be healed. They know whatever that is done to them. So you find that you can actually learn a lot through them. So they should not be neglected on the word. Include them, ask them questions. That's why you are there. So when you're on the word, minimize just idly standing, discussing matters that are not even related to school. Yes, there are those moments you need to discuss, but there are these critical times when the exam is coming, you need to minimize on those things. Okay. Then on the issue of how to practice procedures on the word, look, theory and procedures, theory and practical, they are actually very totally different things. I remember last week because I am I'm working from Jawama Level 1 Hospital. Of course, we learned in pediatrics how to give immunization, but when uh, I went there, my first immunization schedule that I was giving it was BCG. I didn't do it perfect. Of course, I knew that this is BCG. I knew that we need to give 0.05 milliliters. But the practical part on how to inject, because it's actually intradermal, so you need to be very much careful. So, in as much as you have theory, it is not enough to just make you do, uh, you know, the what is needed on the word. So you need to make sure, okay, you need to make sure that you have that confidence. You need to make sure that you have that confidence and make sure that you overlearn the theory. If at all you want to do um, on the dressing, there are a lot of tutorials on YouTube which you can easily watch. After you watch, you follow step by step. Then now you need to read about it, and now you can say that I can now practice. So you can actually use those lessons on the word to say that I want to do this procedure, but under your supervision. The, if at all three can refuse, it's not everyone on the word who can refuse you those opportunities. There are some times when they are just doing nothing, they are on their phones. They are willing to help someone. But they will never tell you to say that, let me help you with this. The one who needs help is the one who asks for help. So if at all you learned theoretically to say that this is how they do on dressing, so you need now to go practice on the word because believe me, in as much as you know theory, procedurally it will still give you some issues. So you need that skill of doing some things uh, with competence. So you need that skill of doing things Okay, so that's the way you can actually practice procedures on the safe words. Of course, there are actually a lot, there are actually a lot of students on the ward. You find that maybe the ward is having uh, 20 students. It's almost impossible for them to start teaching everyone one by one. Okay. But you yourself, just the willingness and the eagerness and the curiosity to know the procedures, you can engage those your seniors, the nurses. Then at the end of the day, they'll give you proper guidance on how to do some procedures. I remember in the second week when we were by China level 1, there are some procedures that we wanted to do, like neonatal resuscitation, how to do neonatal resuscitation. I myself, I engaged the in charge to say that, yes, we learned this procedure, but practical is different. We would want to know how you do it on the ward. We are asking. And most of the time, to find that most of the time, you people who do degrees, actually they have issues because especially when you are reaching third year, fourth years, those people start feeling like you don't need help. Okay, they start feeling like you don't need help. You do need help, but you can't be given help without asking. So there's no way you can just be there without asking and you want to be helped. Okay. So what I was explaining on the same, so so of course theory needs a lot of time. So like the way I explained, theory needs a lot of time actually. Okay. So the way you can tackle them is what I've explained. You are on the word, try to evaluate the work that you already did. The work that you already did, then that way. Okay. Then as I said to say that the theory requires understanding and not memorizing. Once you memorize, you increase the workload. Okay. So actually, this theory in the presence of practicals is actually very simple because you'll be visualizing the practical and theory will be easy to remember. Just like that. Okay. So you also need to create good cues to remember the information. Don't just study the information like you are reading the newspaper. No. If at all there are some parameters you think you are having issues remembering, at least try to create the memory aids, the mnemonics. They will help you do these things. Okay. So memory aid, do not create a memory aid that will require you to study it again. So just create simple memory aid. So like for example, when you are doing history taking, you find that on family history, the well-known mnemonic for remembering what to ask on family history, you just use death. Then death starts with diabetes mellitus, okay, epilepsy, asthma, hypertension. So like that is going to really help you. And like when you want to remember them uh, as complex. So when you create good cues, you remember information so easy on the theory part. Okay. So on the OSCE part, it requires practice and the theory at the same time. It requires practice and theory. So today you make mistakes. Tomorrow you won't make the same mistakes. The other day you have that skill now of doing some things. Okay. Then you need to have confidence. Believe me, it's not easy to do something for the first time. But the only that can take you is confidence, depending on the theory that you have. Because you can't have confidence when you have nothing. So you are always advised to overlearn the material, understand the procedure. Then you have confidence because you understand it. Okay. Then you need to aim to become competent. At the end of the day, you don't want to pass the exams just. You'll be employed. Now, if you are not competent enough to perform these procedures whilst you're on the work, it means that even your career is at stake. They can easily get the certificate, the, the license upon getting it. Okay. Apart from that, you are also preparing for licensure exams which are coming. So if you don't do very good work while in school, even the essential exams becomes very hard. If you memorize most of the stuffs, it's hard for you to start retaining the things. But if you used to understand things, it will be easy to prepare the essential within a short period of time. So the essential is indeed coming, and you need to be prepared for it. Okay? Then you need courage to convert theory. If you don't have, it only takes someone with courage for you to practice it, practice theory. If you don't have that courage enough, believe me, you come out of the clinical location the way you went. You still base yourself on theory. Now, what's the use of coming out of the words with theory when you actually went there to practice it? So there are a lot of students, and don't disguise yourself to say that no, whenever they want to do cannulation, you call on someone. Whenever they want to do whenever they want to give fluids, you call on someone. You are actually just hindering yourself, because at the end of the day you come out without nothing. Okay? And these upcoming assessment on the word, these are going to be assessed at the end of clinical education. They want to assess what we've been doing. That's why I said you need to be there, you need to be involved, you need to practical, no things, no stuffs, so that when they are going to do assessments, it's not even going to intimidate you because you've been doing something. They just want to assess you on bed making, they want to assess you on wound dressing, they want to assess you on catheter care. Why should you be scared when you've been doing that thing? It means that you have that skill. Now they want to see the skill that you've been doing. But always make sure that you do some simple procedures. Because at the end of the day, you don't want to impress anyone, but you want to impress your CA. So the only way you want to do this correct is do some simple procedures. Don't even complicate your life. Just do simple procedures so that you earn marks. Because when you do those complex procedures and wrong procedures, you'll be given less marks. Okay? They are going to disadvantage your grades at the end of the year, at the end of the year, of course. Okay, so this was just a quick guidance. I hope it was helpful in some ways. Okay, and just remember to like the video and subscribe to the channel, okay, so that you may encourage us to continue making more videos.